Happy to have back with us on VLGA Connect Diana Edgerton-Warburton, OAM, a professor at Monash University and a full-time emergency physician. Diana, welcome back to the program. We spoke recently about the work that you're doing in producing resources to promote the importance of social distancing. Your project is also looking at gathering non-medical grade PPE through a crowdsourcing method. Tell us a little bit about how that came about.
Yeah, well, this is a really exciting project. We called it the Triple Win because it's good for healthcare workers, the healthcare system, for business and the community as a whole. And the idea of it is, in a pandemic, we want to conserve all the medical grade equipment for healthcare workers to use to protect the community, but healthcare workers need equipment to train to make sure they know how to use the PPE equipment with confidence. And what we believed was that in the community, there was a whole lot of equipment that bared a high physical resemblance to medical grade equipment, but was non-medical grade. So through crowdsourcing and through the generous donation of a number of companies, we were able to create these packs. As you can see, this one's got my name on it. It's my individual training pack. And we had all sorts of businesses, including optometrists, donate, for example, eye protection, which although is not medical grade, can be used for training purposes to create a very realistic training experience. We actually had local sewers produce gowns for us, which are very high physically resemblant, and over 1,000 masks was supplied by City of Monash that they had that were non-medical grade that we've been able to use for our training packs.
So who's benefiting from these training packs, Diana? Are they just there at Monash, or are you hoping to expand this to other hospitals, other training facilities?
Yeah, so this was a pilot project based in the southeast of Melbourne, and that's where we got most of our equipment from councils and business. But we've just finished the evaluation this week, and we've found that over 90% of our respondents felt the packs were very similar to the equipment, and it improved their confidence with training, and they're going to take it away and use it again. Because we also do in healthcare a lot of what we call simulations, where we go through critical areas such as intubation and cardiac arrest, and these kits can be used every time the healthcare workers are doing those simulations. So really everybody benefits from it because the healthcare workers feel more confident and feel safer. The hospital system benefits from not wasting medical grade equipment, and the community benefits because it's important for people to do PPE safely to keep them safe. So we can use this repeatedly to train with. Before the pandemic, we used to have a number of training packs, which we would share between healthcare workers. But when community transmission began, we couldn't share equipment between healthcare workers.
Makes perfect sense. Now, I know you've got some competition in the background there. So just quickly, what sort of assistance are you looking for? How could you take this to the next level, do you think?
Well, we're looking for funding from state and Commonwealth governments to take this project out, to expand it beyond Monash, to every other healthcare network. So to begin with, we're working at Monash to expand it out from the 70 cases that were healthcare workers to across the whole of the healthcare. It's a big job, but we believe that there's plenty of this other equipment out there. So we'll be looking for volunteers, and local government is a great example of somewhere that may have equipment, as is universities and other businesses. So the type of masks we need are also in nail salons, for example.
Right. So you've given us some examples of councils and businesses that have materials that would help you in this regard. So hopefully somebody watching our discussion today, it's prompted some thinking in their mind, and you can take this to the next level. Terrific idea. It's so simple, but terrific. Well done.
Yeah, well, anyone that thinks they have the equipment, if they go to our website, they can send a photo in and then it's checked by a PPE super user. We actually ended up redirecting a lot of equipment to the medical stockpile. So if people sent medical equipment in, we didn't want that. We only wanted the non-medical grade.
So that's the COVID19as1.com
Yes,
website.
that's
Check it
right.
out for more information, as well as the social distancing project that we've spoken about previously.
Yeah.
Diana, we've taken enough of your time. Thank you very much for being with us on VLGA Connect, and all the very best with these projects.
It's been an absolute pleasure. Thank you.